Hello everyone, my name is Leo and I'm the Senior Executive here at Sarcoidosis UK. I hope everybody is well and thank you very much for joining us for another one of our Q&A videos. Now today we're going to be talking about sarcoidosis and mental health. And the reason we're doing that is, first of all, it's a very important thing for us to be talking about. And second of all, this Sunday, so the 10th of October, is World Mental Health Day. So we thought it would be important for us to come on and do a live video and talk a bit about sarcoidosis and mental health. Now, before we get started, there are a couple of things I wanted to say. First of all, if you are affected by any of the issues that we discuss in this video today, please do seek support. So you can get in contact with us. We can schedule a call from you from our Sarcoidosis UK Nurse Helpline, or perhaps put you in contact with your local support group. I've also included a link in the description of this video to our sarcoidosis and mental health webpage, which talks through some of the support that is available. I would also like to say that if you are in distress or somebody you know is in distress, please do call your GP or call 111. Or if a person is in immediate danger, or if there is danger that they would harm themselves, please call 999 immediately. There are also some other listening services that can provide some good support, and those are the National Suicide Helpline, which you can call on 0800 689 5652, and you can also call Samaritans on 116 123. Now, today we're going to be joined by the fantastic Sarcoidosis UK nurse Jenny, who has very kindly given up some of her time to talk to us about this today. So let's welcome Jenny onto the screen. Hello Jenny, how are you doing?
Hi Leo, I'm fine, thank you.
Great, and thank you so much for joining us. Like I said, this is a very important topic, and I know that people watching today will really appreciate you giving up your time, so thank you very much.
No, not at all, it's what we're here for.
Yeah, good. Well, I know that you have experience and training in the area of mental health, and I know that you've supported a lot of sarcoidosis patients over the years. Could you tell us a little bit more about your experience and your training in this area?
Yeah, sure. I trained as an adult nurse, but I always had an interest in mental health and mental health issues because they're so closely linked with physical health issues. And over the years, I've worked in settings where I've been able to gain quite a lot of experience in working with people with mental health problems. I've worked alongside mental health nurses, I've worked alongside psychologists, and I've worked with people with some quite profound mental health problems, things like schizophrenia, severe anxiety disorders, personality disorders, things that cause them real problems in their lives. I'm also a qualified mental health first aider, and I've trained in suicide prevention as well, which not on sarcoidosis helpline, but on other helplines, I have had to use that training. So yeah, it's something that I enjoy, working with people with mental health issues.
Thank you, Jenny, for all that important work that you do, and it's really great to have you here today and sharing sort of your knowledge and what you've learned in this area. It's really great, so thank you very much. The sort of first thing that I'd like us to talk about is what research has happened on mental health and rare diseases. What do we already know about having a rare condition like sarcoidosis and mental health issues?
The research is pretty clear that people with a long-term condition such as sarcoidosis are more likely to develop a problem with their mental health. People who've got more than one long-term condition, which I know will be some people who are watching today, are even more likely to experience problems, particularly things like depression. Another complication is that sarcoidosis is a rare disease, and that again brings with it some issues, and we'll go into those in more detail later on, I think. But when you look at the numbers, nearly everyone with a rare disease at some point will feel worried or anxious. nearly everyone will feel emotionally exhausted. And a good proportion, something like 70%, will have felt that they're at breaking point with it. So the evidence is that it has an impact on your mental health, and really quite a severe impact. I think at this point, it's really important to remember that we all have difficult emotions. We all feel anxiety, fear, worry, uncertainty. We might feel down from time to time. That's absolutely natural. It's normal. Just the same as we all feel happy sometimes, or excited, or contented, or pleased. They're normal reactions to circumstances and events. It doesn't mean that those kind of feelings are easy to manage, or that they're nice while they're happening, but generally they pass, they're transient. So, and they'll pass relatively quickly, usually when the circumstances change or the event happens that's causing that. So if you're feeling worried about getting test results, for example, once you get the test results, that anxiety should go. It might be replaced by a different anxiety, but the actual anxiety about getting the test results will disappear. But some feelings start to dominate. You might find that they feel overwhelming, they feel unmanageable. And when feelings get to that point, that's when it's a problem. That anxiety that you might have about getting your test results, if you're feeling like that all the time, or you're waking up feeling like that every day, or you're feeling like that in reaction to things that wouldn't normally make you feel anxious, it's a problem. And that's when you need to do something about it. And we'll talk a bit more about that.
Thank you, Jenny. Yeah, and I think some of those statistics are certainly very, very startling, aren't they? And reading about how rare disease patients are affected and some of the things they have to go through. I suppose the next thing that I think is important for us to talk about is why. Why do you think people with conditions like sarcoidosis are particularly affected?
Yeah, I have a huge list. So I hope you don't mind if I work my way through it.
Please do.
These will be things that people are very, very familiar with, to be honest. So the process of actually getting a diagnosis can take a while, a long time for some people. And uncertainty is difficult to deal with. You know, as humans, we don't deal well with uncertainty. So that's stressful. It's difficult to live with. And you're feeling poorly as well because you've got sarcoidosis. So just the length of time it can take, and the fact that there might be a lot of investigations, a lot of which are not much fun. You might have waits for results. All of that means that you are at higher risk of developing a mental health problem. People also sometimes get an incorrect diagnosis first. I've spoken to a lot of people who've been diagnosed with things like cancer, maybe things like TB. Some people have even had treatment for TB before they find out that actually it's sarcoidosis. So that's really stressful because you're dealing with one diagnosis and then all of a sudden it changes and you've got to kind of screech to a mental halt and then start thinking about something else. And I guess in the background of all of that, some people have trouble getting their doctors to believe that there's anything wrong with them in the first place. I've spoken to a lot of people on the helpline who aren't believed by the doctors, or who are told that their symptoms are because of stress or anxiety. And stress and anxiety certainly do cause physical symptoms, and they will make your sarcoidosis symptoms worse. But people with sarcoidosis are sometimes told that it's all to do with the stress and anxiety, when actually it's sarcoidosis. They're told it's all in the head, basically. And that is really, really difficult to deal with because you know that it's not all in your head. But then you start to doubt yourself, you start to feel uncertain again, and we don't deal well with that. You start to feel stressed, maybe your family aren't being as supportive as you think. All of it adds up to a big recipe for your mental health not being great. even once you've got a diagnosis, some doctors, and especially GPs, but some consultants as well, are just not that familiar with sarcoidosis. They don't know that much about it. They might tell you stuff, you know, it'll burn itself out in 6 months. I hear people have been told that quite a lot. Or they say, oh, well, I'm going to have to Google that. Well, that's, again, makes you feel anxious, makes you feel isolated, makes you feel unsupported. And even if you've got the best GP in the world, and there are a lot of really good GPs out there, adjusting to a new diagnosis can take time. And you may be talking months and months for that. It might be 18 months, it might be 2 years before you feel that you've really got your head round, yes, I've got this. Yes, I'm going to have to live with it for the rest of my life. Yes, I'm going to have to manage it. Sarcoidosis comes with a lot of symptoms, which can be difficult as well. Fatigue, I think probably most people will know exactly what that's like. Some people get pain as well. Some people might have a persistent cough, which before the pandemic might just have been, you know, a bit of an inconvenience. But now with the virus, it becomes an embarrassment or something that you're really worried about. You might see changes to your social relationships. Friends might drop away. You might not be able to take part in the hobbies that you once enjoyed. Some people become quite isolated, quite lonely, quite cut off from the rest of society. And I think shielding hasn't helped with that. You might see changes in your intimate relationships with partners or with family. They might not be supportive. They might be too supportive and, you know, want to do too much for you. You might worry about your employment, your finances, about being cut off from things that are happening at work. Because you can't do what you used to do, or you have symptoms that people can see, you might develop problems with your self-esteem. So I think skin problems are really difficult for that, especially if you've got skin problems on your face. But even if they're on your legs, your arms, whatever, if people can see them, I think that's quite a difficult thing to get used to. And that goes hand in hand with the stigma and discrimination that comes with having a long-term condition or a disability. You have to get your head around the fact that you're still the same person, but circumstances have changed. So it's a whole mixture of stuff going on. And not all of it affects everybody with sarcoidosis, but everybody will have to deal with at least some of it. So yeah, a big recipe for developing issues.
Thank you, Jenny, and thank you for talking in so much detail about that. And I think a lot of the time we forget, we spend all our time talking about the physical symptoms and things like that, but we forget that patients might be going through one of these or a couple of these at the same time, or all of these at the same time, which, like you say, is bound to cause effects on people's mental health.
Yeah.
So, as friends, family members, supporters, are there any sort of warning signs that we can keep an eye out for that somebody might be struggling with their mental health?
Yeah, it can be difficult to spot, but there are some things to look out for, certainly, yeah. Changes to somebody's appetite, losing their appetite or overeating, feeling really flat, not wanting to do things that they used to want to do, finding that nothing really makes them happy, struggling to concentrate, being easily distracted, not being able to make decisions, feeling overwhelmed, crying often, crying at things that they wouldn't normally cry at, talking less, withdrawing, or talking more and jumping about a bit in the way that they talk. So they hop from topic to topic. They're not focused. Sleeping more or struggling to sleep, not being able to get off to sleep at night, or maybe waking up in the early hours and not being able to get back to sleep. Being grumpy, being irritable, finding it hard to control your emotions. And for some people, drinking more alcohol, or if they're someone who uses other substances, maybe using more, smoking cannabis, that kind of thing. So there are lots of signs to look out for. They're not always easy to spot. And I think most of us, like I say, everybody goes through good times and bad times. So most of us are going to feel those things from time to time. And that's normal. What we don't want to do is kind of leap into action when somebody's just having a bit of a bad day. But if somebody shows those signs over a period of time and they don't seem able to move away from feeling like that, then that's maybe a sign that a normal emotion has become more of a problem.
Thank you, Jenny. That's really useful, and I think it's a good point about maybe if someone's just having a bad day, that's not an opportunity for you to sort of take over and leap into action. It's more if you see these changes over a prolonged period of time and can really see that person needs a bit of help. So that's great to talk about the sort of warning signs, and a natural follow-up question to that is, let's say we've got some concerns, we've seen some of these warning signs. What can we do to help? Is there anything we can do to help?
Yes, yeah, absolutely. I think if you see someone that you feel is struggling or who is telling you, because some people are happy to talk about how they're feeling, talk to them, encourage them to tell you what's wrong. Bear in mind, though, that not everybody is comfortable talking about the feelings. It's a very individual thing. Some people will happily tell you how they feel, and that's brilliant. Some people will absolutely not be comfortable with it, and that's also fine. It's what's comfortable for them. So don't push somebody to talk if they really don't want to. As friends and family, you know what they're like. If they've never been happy to talk about the feelings, they're probably not going to start now. But you can do things like encourage them to see their GP. If they don't want to see the GP, you can actually phone the GP and just say, look, next time so-and-so's in, would you mind having a chat with them? I think they might be feeling a bit down. And the GP, obviously, patient confidentiality means that they can't tell you of what's going on with the person, but they will make a note of that, and they should have a chat with them next time. You can get some of the resources that I know Leo has a list of. There are some brilliant leaflets out there about coping with stress, coping with anxiety, coping with depression. And you can get hold of some of those and just hand them over, or leave them where you know the person will find them. And hopefully they will pick them up and take something from that. If you feel that someone is really struggling, and I guess this is a good time to talk about suicide. If somebody talks about suicide, take them seriously. They might not use words like, I'm going to kill myself, or I'm going to commit suicide. They might say things like, I've had enough. I can't take any more. It would be better for you all if I wasn't here. Those kind of things are the red flags. And most people, about 80% of people who've got suicidal thoughts, will let you know somehow. They will do things like giving away the possessions or making arrangements for the pets to be cared for. Or they will say things like, I've had enough, I don't want to be here anymore, I've had enough. If somebody starts saying those kind of things, ask them directly, are you thinking about killing yourself? I do it on the helpline. It's not an easy question to ask. It's not something anybody wants to have to ask. But if you ask somebody, it gives them the opportunity to say either, no, it's just a figure of speech, I'm having a bad day, Or, yes, I feel absolutely rubbish. I've had enough. And yes, I'm having thoughts of taking tablets, jumping in front of a train, whatever. So if you feel that you can't ask that question, find someone who can. Maybe a friend, a family member, a healthcare professional. Get someone to talk to the person about how they're feeling. And if they say that, yes, I am feeling that bad, that's actually really positive because they've told you. And then you can do something. You can get them an appointment at the GP. You can, if you think it's really urgent and they've got a plan and they've got the tablets and they're going to do it next Tuesday, you can call 111 and speak to one of the mental health nurses. There is something that you can do at that point. And the vast majority of suicides are preventable. It's unusual for it not to be. So, and it's a subject nobody likes to talk about, but it's really important to get it out there.
Thank you, Jenny. Yeah, it certainly is a really, really tough thing to talk about and to listen to as well. But thank you very much. I think you gave some really clear, practical advice there for people who might find themselves in that situation. So thank you very much. If we kind of move a little bit to talking about COVID, if that's okay. I think COVID in a way has kind of shone a spotlight on mental health reasons, because I think a lot of people really struggled, particularly during those first couple of lockdowns, and it was something that we were talking about a bit more. Perhaps one silver lining to come out of the last sort of year and a half is people started to talk about mental health a little bit. But it's also very clear that certain groups had a lot more to deal with during the last year and a half, and I think people who were identified as clinically extremely vulnerable and had to shield had faced particular difficulties that a lot of us didn't have to face. So my question is, what, in your opinion, in your experience, what effect did the COVID-19 pandemic have on sarcoidosis patients?
Yeah, I think you're right. It had an effect on everybody, whether they were shielding or not. But absolutely, people who were shielding had very different things to deal with. They might have become very isolated, not able to see family, not able to do the hobbies, not able to do maybe the things that they would normally rely on to help with the mental health. So if you're someone who enjoys exercise or going to meet your mates down the pub and you feel that is something that really helps your mental health, all of a sudden that's gone. And it's been gone for 18 months. So that's a really big thing. You might have become quite lonely. You might have felt quite trapped. And people who have been shielding and who have now been asked to kind of get back to normal kind of thing might also be feeling some real anxiety about doing that, about going out and about again, about mixing with other people. So it's not just the shielding, it's the shielding being lifted as well. You might be frightened of the virus. Crikey, how many people have died of it? And, it's a scary thing. Everybody's been scared of it. So even with the vaccination program doing really well, people are still probably going to have a bit of a hangover fear of the virus. They might not have been able to see the consultants or the GPs for a long time. I know my GP is still only doing phone consultations, and a lot of consultants, even now, are only just getting back to face-to-face consultations. So you might have had that anxiety as well. And I think as well, a lot of people with sarcoidosis are actually doing really well. They're getting on with everyday life. They're going to work. They're managing it with medication, or maybe even not with medication. So they're doing pretty well, and they may not have felt the need to tell anybody that they've got sarcoidosis. And then all of a sudden, you're told, right, you're clinically extremely vulnerable. Let's slap that label on you, and you're not to leave the house for 18 months. That's all of a sudden you've got that change of identity. You're going from someone who's coping really well with life and coping with having a long-term condition to being given an unwell identity or disabled identity. And that might have taken over from all the other identities that you have, that we all have. You know, someone who goes to work, someone who has grandchildren, someone who likes to go to the footy. All of a sudden, the only label that you're left with is the one that says poorly. And that's pretty difficult to deal with as well. And I think just the uncertainty, you know, it landed on us all like a ton of bricks, and we don't know when it's going to finish. And I know things are changing, and, you know, shielding has been lifted and we're all trying to get back to normal, but actually there's still quite a lot of everyday uncertainty out there. Should I go to this gig, or should I give my tickets away? Should I meet up with those friends, even if it's in the park? Or should we just stick to Zoom? Should I go back to the sarcoidosis support group? You know, people have got a lot of fears, a lot of anxieties, a lot of uncertainties that they're dealing with. And all of those are going to have an impact on your mental health, even if, generally speaking, your mental health is very good. All of those things will have had an effect.
Yes, definitely. So another question for you is, well, we all have mental health. Some of us have good mental health, some of us bad, some of us fluctuating. What do you know of any resources for people who want to work on their mental health, regardless of their starting off point?
Yeah, absolutely. There's really quite a lot out there. Obviously, if you have a diagnosis of a mental health condition, then hopefully you will have some support from your GP, from maybe mental health professionals like a CPN, a community psychiatric nurse, maybe a psychiatrist, maybe a psychologist, maybe counsellors. You know, hopefully you will have a support network in place there. And if you feel that, if you're in that position and you feel that your mental health is worsening, then you should always speak to those people first. Get the professionals involved first. Likewise, if you feel that you really are struggling, that things just day to day are very, very difficult because of your mental health, then talk to your doctor. Ask for a referral to mental health services or to whatever is available in your area. It can be a bit patchy. Because the self-help stuff is absolutely brilliant, but it's not right for everybody. Some people need more intensive input. So the kind of the self-help stuff that can help, Mind, the charity, they've got some great stuff. They've got support groups. They've got loads of information on their website. They've also got some really nice videos on their YouTube channel, things like coping with stress, coping with anxiety, managing stress, eating well for managing your mood. These are not long videos. I think they're all about 2 or 3 minutes, something like that. So just little snippets of advice that might just give you some ideas. There's a helpline called Calm. And if you're in Scotland, there's one called Breathing Space, where you can get some advice from someone who is trained in mental health issues. Breathing Space have, I think, psychologists as well who you can be referred to see. And some other charities have things like that as well. You know, charities specific to various health conditions. So if you've got cancer, for example, the Macmillan helpline can refer you into mental health support. And I know that there are people out there who do have both cancer and sarcoidosis, or who had cancer before they developed sarcoidosis. The Mental Health Foundation have some really good PDF leaflets, supporting your mental health at work, managing stress, looking after your mental health using exercise. And I think Leo has the link for that. There's one of the NHS trusts as well. It's Northumbria Tyne and Wear Trust, has a really good selection of leaflets on topics like anxiety. I know we talk about anxiety a lot, depression, health anxiety, sleeping problems, using alcohol to help you cope and why that's not a good idea, and how you can help yourself if that's what you're doing. They're all available as PDFs online. Some of them are available as audio files. I think 1 or 2 are available as videos, and you can even order them for a nominal fee of, I think it's £1. You can get a hard copy of it sent to you. So again, I think Leo has the link for that. And obviously Sarcoidosis UK has its own support groups. And some people, again, not everyone, it's finding what works for you here. But some people find it incredibly helpful to go along and talk to other people who have the same condition, understand what you're going through, and can give you hints and tips, can listen to you, can just be there as a listening ear and someone who really understands things. So there are quite a lot of resources out there, but like I say, if you have a diagnosis, if you have a support system there, or if you're really struggling, you do need to head first and foremost for the NHS. Get yourself some support.
Thank you, Jenny. Thank you for going through all of those resources. I think you're absolutely right. So if you have a sort of clinical need, then maybe some of those aren't necessarily for you. But there is something out there, I think, for everyone to improve their mental health. And I've just posted a link in the comments of the Facebook videos. If anyone is interested, they can follow that link too. So I want to talk about making mental health a priority. I think the conversations are starting to happen now, more so definitely than when I was younger. I've definitely noticed that. I think we've probably still got a long way to go, but people seem to be having the conversation more about mental health now. Why, in your opinion, do you think it's important to make mental health a priority? Sorry.
I think because mental health affects everything. If you're not feeling good about yourself, it's going to make it harder for you to function in day-to-day life. It's going to make it harder for you to do the stuff that you need to do. It makes it harder for you to hold down a job, to hold down relationships. It makes it harder for you to just be able to deal with life, what life throws at you. And when you've got sarcoidosis, as some people out there will know very well indeed, life can throw all sorts of stuff at you. Some of it predictable, some of it a bit less so. So if your mental health isn't good, you're going to find it a lot harder to deal with all that stuff. And I guess practically, if your mental health isn't great, it's likely to make your physical health symptoms worse. So anxiety, for example, can make pain, it'll make it worse, as in more painful, and it makes it harder to cope with. So it's really important to address the mental health things, just so that people are coping better and having a better life and a more fulfilling and satisfying life, and so that the physical health symptoms are better controlled and people are better able to deal with them. That's something that we should want for absolutely everybody. But you're right, Leo, there is a long way to go. I think when people like Prince William and Prince Harry get involved, it shows that it really is getting up the priority list. But yeah, there's a way to go yet.
Yes, absolutely. I'm going to ask you one final question, Jenny. I think it's quite a tricky one. What needs to be done to improve the current relationship between physical and mental health, and integrating mental health care with rare disease services?
You're right, that is a tricky one.
Sorry.
Well, I mean, I guess it's wrong that mental and physical health are separate anyway. Because people with mental health problems, if you've got a diagnosis of schizophrenia, the chances are you've got some physical health problems going on as well. I can practically guarantee it. If you've got any severe mental health diagnosis, the chances are you've got physical stuff going on. If you've got a rare disease, like sarcoidosis, then the chances are that your mental health isn't as good as it could be. So they always go together. But often you only get one side of it addressed. And I think people need to have their concerns about their health taken seriously. GPs need to listen to patients and refer on when things are just not getting better. And that's for both mental health and physical health. I think people with rare diseases, unfortunately, need to become advocates for themselves. They need to be able to say what their needs are. They need to be able to push when necessary and to get things taken seriously. And if you are just in a place where you can't do that for yourself, and there will be some people out there who just don't feel able for whatever reason, maybe the physical health, maybe the mental health, maybe both, who just don't feel that they've got that fight in them, well, you probably need to get hold of an advocacy service. They can help you push and have that fight. They can do the fighting on your behalf. Because, yeah, there's a long, long way to go. I know some services are offering mental health support now for people with rare diseases. And it is gradually creeping up the list of priorities, but it's rare disease services tend still to be very much about dealing with the physical symptoms, making sure that people are on the right medication, that kind of thing. So hopefully in the future, we'll see counsellors, psychologists, maybe a mental health nurse attached to rare disease services. But there's a little way to go for that first. So at the moment, you need to be an advocate for yourself. And that's where things like the Facebook group is really helpful, where all the Sarcoidosis UK information is really helpful, and where advocacy services, where needed, can be really, really helpful. And things like PALS as well. It's a stressful thing having a rare condition and having to juggle umpteen different consultants and all these different appointments. So get as much help as you can with that.
Jenny, thank you so much. I thought that was just a brilliant answer to a very difficult question that I asked you, so thank you very much. I think we'll draw this to a close now, but I just want to say, Jenny, we are so grateful, and we really do appreciate you for giving up your time today and for everything you do for sarcoidosis patients. I really appreciate it. I've really got a lot of today, and I know that a lot of people watching will do too, so heartfelt thank you.
You're welcome.
So thank you very much to everyone who joined us today for this Q&A. Just before we finish off, I would like to repeat that if you are affected by any of the issues we've talked about today, please do seek support. If you need to get in contact with us, you can do so on info@sarcoidosisuk.org. On another note, our next live patient event is going to be on the 28th of October and be starting at 10 a.m. This is going to be a patient morning with the Royal Brompton and Harefield hospitals. And the theme of this event is going to be COVID-19, vaccines and sarcoidosis. So another really, really important topic that we're going to be talking about this time with the Royal Brompton and Harefield hospitals. I can confirm that the speakers are going to be Dr. Kelleher, Dr. Hossein, Professor Wells, and the event will be chaired by Dr. Karanos. Some really fantastic speakers who hopefully will be able to provide us with a bit more information about COVID-19 and vaccines and what we need to know in terms of these two things and sarcoidosis. You are now able to register, so if you scroll back on our social media posts, you'll see the link to register, and we'll also be posting more information about this event next week, as well as sending an email to our mailing list with more information about the day, the speakers, the programme, and how to join us for the webinar on the day. So thank you very much for joining us today, and we look forward to seeing you at our next video. Thank you very much.